What is not your typical method of treatment, but many patients are using meditation to slow down progress of heart disease. Dr. Lamba is part of the team at First Coast Cardiovascular Institute. And Dr. Lamba, give us an idea of how this works, and does it really work? Obviously, you're here to say it does.
It's a real privilege to be back here, and I thought I'd take this opportunity to introduce a concept. If we talk about literature, there have been more than 400 peer-review studies which have shown benefit of meditation on not only decreasing blood pressure but also preventing and slowing the progression of heart disease.
So meditation, when you say meditation, is it just sitting there and relaxing? What is the definition of meditation to get these results?
Okay, so typically when we think about meditation, we think we have to think cross-legged with our eyes closed and think of divinity in the heart. But really, if you look at what defines meditation, is derived from the Latin term meditare, which means to contemplate, ponder, or introspect. Essentially, it is any technique by which you can promote relaxation, building of this internal life force known as pran or chi in ancient cultures, and develop virtues of spirit, compassion, love, generosity, patience,
What is
forgiveness.
this physically doing to the body? What is it doing that it prevents something like heart disease? I've never heard of something like this.
So physiologically speaking, when we get stressed, there are two parallel systems, nervous systems, that regulate the heart and the vascular system or blood pressure. So there's the fight or flight response, or the sympathetic nervous system, which when gets activated sends signals for the heart to beat faster, harder, and causes the blood pressure to go up. And that's what anxiety does.
Sure.
What meditation does, or putting the mind within, or focusing on the heart, or any technique. It could be walking in the park. It could be, petting your dog or cat, or listening to your favorite song. What that promotes is suppression of the sympathetic nervous system, or the flight and flight response, and promotes activation of parasympathetic nervous system, or the vagus nerve, which has beneficial effects on the heart and the vascular system by slowing down the heart rate, by decreasing blood pressure.
So these are things that we can start to recognize in our body. So if we have this fight or flight response, we can then learn that that's coming on, then try to learn how to suppress it, and by essence in doing that, you're preventing yourself from possibly suffering from something like heart disease?
Absolutely, absolutely. We know that there are inciting events for heart attacks, for strokes, and they are usually related to activation of the sympathetic nervous system, hypertension. As you can see in the slide, of all methods, the transcendental meditation has been shown to be the most effective method to decrease blood pressure.
How do you do this, though? I mean, it sounds like so easy. Like, I'm just going to get stressed out, I'm going to go relax. But I mean, but it's probably harder than that. Is it something you have to start from a young age and train yourself?
So I have a last slide here, and I want to take this opportunity to introduce the most popular poet in the world today, Maulana Jalaluddin Rumi, who lived 700 years ago, who has encouraged us to find divinity within, find our hearts. In other words, what we are trying to seek all lies within us. Now, there are so many different methods of trying to do that, but the bottom line is we've got to take time out for ourselves on a daily basis to fill our own bucket.
Yes.
So do
and
things.
Trying to find that is the million-dollar question.
Exactly.
Right.
And it's different for each person.
Yeah.
And so you have to recognize what relaxes you, what promotes in you a sense of well-being, that you can connect with your inner self, the true self.
You're a physician, so I mean, I'm putting you on the spot to ask you this question, but is there something that you do that you find that helps you? I mean, do you practice this?
Absolutely. If I don't take out 30 minutes in the morning and sit by myself and introspect, my day is not the same. And having said that, I just want to point out that, as physicians, we do a terrific job of treating symptoms, but at the same time, the process of healing or curing of an individual really begins from within.
Yeah.
I mean, they have to, when each cell of the body, dances with the rhythm of the universe, and you can feel that divinity within, is when the process of healing and well-being starts.
It's very deep, but it's a good basis to start. It's all talking about, in this fast-paced world that we live in, and everything is just so instantaneous. Everyone has their phones. Everyone is trying to pick up the kids, get dinner ready. It's just good to remind yourself to take a break and sit and think about your health first. And take a deep breath. I think that's what I want to do. Okay, thank you so much.
Thank you very
appreciate
much.
you being here. And thanks so much to First Coast Cardiovascular Institute for coming on and sponsoring this segment. And remember, know your body, know your risk factors, and work with your doctors to address them. If you want more information from First Coast Cardiovascular Institute, you can visit firstcoastcardio.com. You can call them. The number is there on your screen, which is 904-493-3333.